My name's Scott Whitman, and I'm from Boca Raton, Florida. So I'm a health insurance agent. I'll talk to a lot of people, and they're impressed a lot of times with like, "Oh, you know this or that. No one knows that." I don't want to tell them too much, but I usually went through that myself. That was around 2012. I ended up with a real high fever from an infection. So I was in the hospital and like intubated and like the medically induced coma and antibiotics. So then it was after that I started having seizures consistently, and I had to get on medicine for it. And I didn't have health care. And this was back before I knew about like the Affordable Care Act and everything. So it was just bill after bill. I've been in the hospital times when I didn't know like where I was going to get out. One time I was there for long enough, I lost my house. But at that point, like my mom and dad came around, they're like, yeah, like this is out of hand. Like, do you want us to pick up your stuff and like move it in the garage? And then you can come stay here till you figure it out. And I just ended up staying there permanently. I have a neurologist, Dr. Chi, and she recommended Botox treatment for my migraines as a result of the seizures. But they're just not affordable. So that was like, $800 or so every 3 months, even with insurance. So I told her I'd like to, but that's just not really in the budget. On top of paying for the insurance, she's like, well, there's programs, and financial things that we can do. It ended up for the first 3 treatments was $20. So they still found a way to run it through the insurance and sent me through the proper channels instead of just saying, oh, well, sorry. It is really embarrassing, like walking into those situations, with a doctor, and especially you're there, you're that person, you need a treatment or you need a service, but you don't have the money for said treatment or service. So, a couple things I think that could reduce the overall embarrassment for the patient in that situation. Number one is knowledge, staff and like the doctor knowing about any program and anything that works with, a certain med, a certain treatment. There's often manufacturer, or producer programs that are super affordable. I mean, it's two sides to the coin because, like, I definitely know they're busy. Like, you got lives to save, literally. But if they knew and you had the opportunity to ask any one of them and get an answer, that would be great. I think that would be really helpful.